Hello everyone, I am Navya and welcome to this course on understanding HIPAA compliance. In this course, you will get an understanding of the Health Insurance Portability and Accountability Act or HIPAA. You will also grasp the significance of what PHI or Protected Health Information is and how and why you should ensure its privacy and security at all times. In this course, you will also know the three prominent rules under HIPAA, namely the Electronic Data Interchange Rule, the Privacy Rule, and the Security Rule. You will also gain an insight on what are data breaches and how HIPAA compliance can be enforced. I'm sure you will appreciate learning various concepts of HIPAA and its importance. So, let's get started. Now let us look into the objectives of this course. In this course, you will be able to define Health Insurance Portability and Accountability Act or HIPAA, distinguish the objectives of HIPAA, tell what is PHI or Protected Health Information, explain how and why to ensure the privacy and security of PHI, define the three rules, Electronic Data Interchange Rule, the Privacy Rule, and the Security Rule, and identify data breach and HIPAA enforcement. The Health Insurance Portability and Accountability Act or HIPAA was signed into law on August 21, 1996 by the then President Bill Clinton. HIPAA is a sequence of national standards that healthcare organizations should look into to safeguard the privacy and security of protected health information or PHI. There are industry-wide standards decreed for dealing with healthcare information and maintaining the confidentiality and security of sensitive patient information. It covers any type of health data that is involved, be it physical data, that is data on papers, or electronic data. HIPAA gives control to patients over their health information. It also defines the penalties in case of violation. Due to an increase in information exchange over electronic media these days, and due to concerns over losing privacy, Privacy Protection Acts have become an integral part of today's medical transactional activities. What were or are the objectives of HIPAA? HIPAA was initially introduced to reduce cost, simplify the administrative process, and maintain the privacy and security of patients' health information. And today, the main objective of HIPAA is 1. To make sure that the individuals could maintain health insurance between their jobs and also in cases if they lost their job. With HIPAA in place, millions of American workers and families could continue their health insurance coverage when they lose or change jobs. Another reason for creating HIPAA was to minimize or rather prevent healthcare fraud and waste, hence the term portability in HIPAA. The second objective was to maintain the confidentiality and security of patient health information while handling or transmitting such information, hence the term accountability. The HIPAA training or certification can be taken at an individual level or at an organizational level. HIPAA training should be conducted for all employees, new employees who have been hired into the healthcare industry, and should be refreshed periodically. Whenever there's a change in the HIPAA regulations, the employees should be retrained on those regulations. Now let's get an understanding about who has to be HIPAA compliant. HIPAA applies to whoever deals with the transmission and processing of health information. These include the healthcare providers, health plans, and healthcare clearing houses. Any person or organization that provides healthcare services is called a healthcare provider. These include your doctors, nurses, therapists, administrative staff, pharmacists, etc. An individual or group of medical plan which pays for or provides medical care is called a health plan. Healthcare clearinghouses are public or private entities that process the health data received from another entity. They mainly operate in converting the transactions from non-standard format to a standard format or vice versa. It may include your billing service, health information management system, etc. They process the data between the healthcare providers and the insurance payers. So we can say that being HIPAA compliant is applicable to all persons working in a healthcare facility or private office, to students, to non-patient care employees, to health insurers, to billing companies, to electronic medical record companies, etc.